Well, the time is just gone 7 minutes past 8, and we kick off this morning. Take a look at the Nehawu strike, the impact that it is having on the health sector. And we're going across now to be joined by Lwazi Nkolonzi, Nehawu National Spokesperson. Lwazi, good morning to you, and welcome to the show.
Good morning, and good morning to your viewers at home. Listeners at home.
Yes, it is clear that the Nehawu strike is raising raising huge concerns right across the country, considering that, how widespread the strike is. And let us just, before we get to some of the issues that have arisen as a result of the strike action, just give us an overview as to the strike, the purpose, and, what is Nehawu actually calling for by having the strike?
Thank you. Look, the strike comes as a result of collapsed wage negotiations at the Public Service Coordinating Bargaining Council. We were in negotiations with the employer, the government, as far as back from May last year, 2022. Up until October, where the negotiations collapsed, and we were subsequently issued a certificate of non-resolve that enabled us to embark on a strike in the public service. And part of the reasons why those negotiations collapsed is that government was not willing to accede to the demands that were placed before them. Key amongst the demands that we were calling for, we were demanding a 10% salary adjustment, a 2,500 rand housing allowance. We were also demanding a bursary scheme for children of public servants, and also the renewal of the government, the implementation of the government housing scheme, the immediate implementation of that scheme. But government did not respond to our demands accordingly, and they were arrogant, and they displayed a posture that was disrespectful to the whole process of collective bargaining. And in the midst of that, the government went ahead and implemented unilaterally a 3% increment that was rejected by majority unions of the PSCPC, clearly demonstrating to us that the government is intent on undermining collective bargaining, undermining the rights of workers. And further to that, after we had obtained that strike certificate in November, we further engaged the government. We called on the government to have talks and consultation with us, but they still persisted with their arrogance. We marched, we submitted memorandum demands, and also this year when the Minister of Finance was delivering the budget speech, once again we marched in Cape Town and in Tshwane, where we submitted once again memorandum of demands to the government to no satisfactory answer. We did not get a response to them. And then on the 23rd of Feb, we then formally submitted our intent and the notice to strike. And that is the background, the long and short of the background as to how this strike has culminated to the point where we are.
Lwazi, how far are you prepared to take this strike action? Because we've seen comments come through like we will not retreat, and how protests to continue until salary demands are met. And clearly, how concerned are you as to what impact this is having on the health sector right now?
Look, the strike can end immediately tomorrow if government comes and accedes to our demands. The strike will end tomorrow. But the problem is that the government does not want to listen to our plight. The government is not interested in the plight of public servants. This is an uncaring government. So, and our members are quite resolute that they are going to forge ahead with the strike. indefinitely so up until government accedes to our demands. And we've always said we've got an open door policy as Nehawu that we would call in government. Come, let's talk. Come, let's resolve this impasse. But central to that, can you accede to the demands that we have placed before you? But what has government done? They've been arrogant as usual, and they've undermined our rights as workers. And our members are quite resolute that, look, for the past 3 years, we have not gotten any salary increment, none whatsoever. And we are expected to deliver quality services. Yet we are not remunerated accordingly. We are not taken serious by this government. We are treated as second-class citizens of this country, and that comes to a stop. So the ball is in government's court as to when do they agree to our demands so that we can resolve the strike as soon as possible.
Now, also, Lwazi, I've seen certain media reports calling this a death strike. And when one looks at the disruptions that have taken place across hospitals around the country, and also looking at the direction or the dimension that the strike has actually taken, to the point that, it is almost to a point of getting violent. We've heard about reports, where health workers have been shouting slogans like "kill the poor, kill the farmer." Now, all these things have been playing out during the course of the strike. Is this actually helping your cause?
Look, as now, we are not in the notion of disrupting the public health care system. In fact, Nehawu is one of the unions that have been championing the transformation of the healthcare system, and we have got a high moral ground with regards to how we have contributed to the development of the healthcare sector in this country. So, at no given moment would we wake up suddenly to destroy what we have built over the years. No, that's not the intent. But two, want to dispel this notion that our members, by exercising their rights within the confines that are prescribed within the Constitution, the Bill of Rights that guarantees workers the right to strike, but most important as well, linked with that, the essential services component. As Nehawu, to address the issue of essential services, we wrote to the Department of Health, we wrote to provincial departments, we wrote to various hospital management, saying to them, can we meet so that we have an agreement on the minimum services that are going to be provided during the strike? What did they do? They ignored us bluntly, they were arrogant, and they did not want to listen to us. We took an initiative because we understand that health is a critical sector, it's an essential sector. But we said, let us have an agreement in terms of the minimum services so that there are no disruptions. And the government and the Department of Health, various hospital management, HODs across provinces were arrogant to us, and they did not want to meet because they do not want to have a minimum service level agreement in place in the health sector, which is an essential sector, and it give our members their constitutional right on embarking on a strike whilst we are not disrupting the health services. They don't want that. And I think if you were to classify this strike as a death strike, it should be blamed on government as to how it has treated healthcare workers. If you go to the various hospitals across the country, the infrastructure is dilapidated, the working conditions are unbearable. One nurse services more than the amount of people she or he is required to service, right? One nurse does the job of 7 people. That is not the type of healthcare system that you would want, right? And this healthcare system has been on a decline. And the government should be the one that takes the responsibility for that, right? We have seen under COVID how our members were in the front line of saving lives in this country. They were in the front line of fighting the pandemic. And yet, at the same time, they were not being remunerated by the government. The government never gave them any salary increment. The government never even gave them any token of appreciation with the sterling job that they've done. Many lives were lost in the process. Our members died in the trenches, saving lives. The same government were locked up in their houses. They were not doing what our members were doing. And yet, these members are essential services members, but their pay is not essential. So how then do we comprehend with that? And we are expected to understand that. Our members have made it a point that they're not going to take that. They are going to embark on a strike. And that's what they're doing. The notion that this is a death strike should be placed at government's door.
Yes, Lwazi, I can understand and I can appreciate what you are saying with regard to the government, as far as the government is concerned, not taking full responsibility for its actions. And you rightly point out the fact that the health services is in a decline at this point in time, coupled with many other issues, the corruption. We know what had taken place at the Tembisa Hospital, skinny jeans, all these type of things, and the government is just not taking responsibility. But what we've seen, the reaction from the government, we've seen the health minister making claims that lives have been lost during this strike, and to the impact where they are talking about disruptions of medical services, going to the court, getting an interim court interdict as well against Nehawu.
Look, once again, we reiterate that we are not the cause of the lives that are lost. We are not the cause. You see, there are some instances whereby the department I was listening to a spokesperson talking about Nehawu members being violent and barricading a certain hospital, right, in KZN. But funny enough, the provincial secretary of Nehawu in KZN was right in front of the gates that the spokesperson of that department was alleging that the government officials of the health department in KZN was alleging that it's closed. And it was not closed to an extent that our provincial secretary even made a live recording to demonstrate that our members are demonstrating peacefully. They are allowing access to healthcare facilities, and they've not intimidated anyone. There's not been violence on our side. Yes, there has been sporadic incidences that have occurred, right? But equally there, in those instances, we should ask a question: what has led to those instances? For example, here in Gauteng, in Lerato, an incident happened on the first day of the strike, whereby our members were shot by private security that was brought into the hospital by the management of that hospital. Now, we cannot be blamed for that as Nehawu. I am saying, yes, we do acknowledge that there's been some incidents that have occurred, but generally across the provinces, we have not services are running, and we have not disrupted any services. We've allowed people to access healthcare facilities.
Well, Lwazi, we're going to have to leave it at that. We thank you for taking time out this morning, and we trust and hope that the matter can be resolved as soon as possible. But we do appreciate you taking time out this morning, talking to us. We wish you all the best.
Thank you very much.
Lwazi Nkolonzi with us this morning against the background of the Nehawu strike. Are we going to go for a quick break? We'll come back. We'll be joined by the UCSA General Secretary. We'll be joined by the Secretary General, Maulana Yusuf Patel.